I'm here to talk about the links between stress, anxiety, and depression and why it's so relevant in this day and age.
Environ Life Science Limited, partnering for life.
Hi, I'm Dr. Divya Sekhar, consultant psychiatrist practicing in shadow clinics and diagnostics. I'm trained in trauma therapy specifically. I'm here to talk about the links between stress, anxiety, and depression and why it's so relevant in this day and age. So even before 2020, mental disorders contributed to the global health burden, that is, as a leading forefront runner, and depression and anxiety were the topmost. But what's interesting to note is, as per WHO, even from 1990 onwards itself, there has not been a decrease in the global prevalence of either of these disorders, that is depression or anxiety-related disorders, despite the fact that there has been compelling evidence in the impact of the same reducing due to treatments that the people are getting. So which means there is a key link that we are missing as to why the prevalence has increased and is being sustained over the last 30 years or so. So post the pandemic, that is after the COVID 2019, it has brought about a lot of changes in our lives, which includes creating an environment that is actually exacerbating all the mental health risk factors. Fear and uncertainty seem to play into our lives much more than we ever thought of, and there's this lack of control, a feeling that we can't control most things around us, that is prevailing, which is a key factor in leading to stress, anxiety disorders, and depression. So recognizing what the differences between stress is, anxiety, and depression is will help us in addressing each of these disorders effectively. Let's start by defining what stress would be. So stress is a physical response that happens in our biology, in our body, that is, as a response to the brain detecting anything that is threatening its internal stability, so which we call as equilibrium. So when that is triggered, what happens is two main things. One is the neurotransmitters, that is the neurochemical messengers in our brain are released, and they overwhelm the higher centers in our brain. So let's imagine our brain having multiple levels of functioning. The topmost brain, that is at this level, the cortex level, is the highest and the most advanced evolved part of the brain. The lowest would be the primitive and the part of the brain which is responsible only for automatic reflexes. So now when the stress response is triggered, the neurotransmitters get released at a high level and they overwhelm the higher center of the brain, that is the cortex, which is responsible for our executive planning and logical thinking. And below also in our body, near the kidneys, there is the adrenaline glands, which also release the adrenaline and cortisol hormones. Now the neurotransmitters like serotonin, dopamine, etc., and the hormones from the adrenal gland, that is the cortisol and the adrenaline, work to put the body into a physiological response which increases our heart rate and basically prepares the body to act against any danger. Now this was a very needed response in our earlier times. Millions of years ago, this was what probably saved us when in the face of danger like animals coming on towards. But now we are in a unique situation where this particular response, stress response, seems to be triggered constantly throughout the day, and it's become a universal phenomena, almost a unique modern day pandemic, wherein every day we find ourselves at higher levels of these stress hormones. Now, what served to alert us before The biological function of these stress hormones is alerting us and preparing us for danger, is the same thing that is now corrupting us. The signal is got corrupted, wherein it is the prolonged stress hormones lead to detrimental effects both physically and mentally. So physically, it leads to effects like increased risk of heart disease and infections. It weakens our immune system. Mentally, of course, the link is it causes disorders like anxiety and depression. Now, knowing this, what can we do to address stress and who should be addressing stress on an everyday basis? In the current scenario, it is assumed that everybody in this world is under some amount of stress, and there are some strategies that can benefit in addressing stress on an everyday level. So the first important tip to address stress would be exercise, prioritizing exercise and a balanced diet. Now, this particular advice has been told by multiple people for many things and it's almost worn out, but then it's actually very helpful because exercise releases the same hormones that would come from relaxation response, that is opposite of that of a stress response. So it increases the oxygen levels in the brain specifically, which helps in calming down, and it also increases the levels of the neurotransmitters that act in opposition to the stress response. In that way, it helps in curbing the stress levels. The second thing would be to establishing some sort of a personal routine. Now, how is this beneficial? When we have a personal routine that we can structure, we bring in predictability. So we are addressing the first thing that stress is due to, which is unpredictability and fear of the unknown. So when each of us have personal routines, it rewards us with a sense of some sort of control over our future at least, and can also help us, if we can plan properly, we can also bring in activities which give us a sense of personal meaning. Brings me to the third tip, which is engaging in activities which have a personal meaning for you, which means one of the most central resilience factor against stress or against any kind of an external event is purpose in life. And engaging in activities that give you a personal meaning will help us increase purpose in life, and in that way we can combine having a structured personal routine which includes such activities. Now moving on to the next one, which is anxiety. So anxiety biologically and physiologically is actually the same as the stress response. The key difference is the neurotransmitters which have been released work at a rampant level and are in our system even when the threat is removed. So this neurotransmitter overwhelming our higher center in the body and not letting our higher center act is going to make the primitive center in our brain, that is the amygdala, which is at the lower center in our brain, which is also known as the seat of fear, come and work in full force. So when high levels of these stress hormones are constantly there in our body, there is also the second event of forming repetitive worry loops. So biologically it's the same as a stress response with these two differences, that is the neurotransmitters at a high level even in the absence of threat, and also there are repetitive worry loops that are formed in our brain. Now at a thought process or a more emotional level, anxiety can be identified as a feeling we have when we feel that we are dealing with something that is outmatching our internal strength, our internal resources. That is, we feel that we cannot match the external stressor. This is how a person would experience anxiety, but biologically it is a neurotransmitters acting rampantly. Now, how do we deal with anxiety? If we've identified this, anxiety, few steps to address this would be, again, engaging in activities which are grounded in mindfulness. So I was saying anxiety brings in a lot of repetitive thought loops. So usually a person who is undergoing this anxiety disorder would generally would be fixated on thoughts which are either in the past or in the unknown future. So engaging in activities like either journaling, focused coloring, doodling, or any guided meditation can help us ground us to the present, and this will cut the anxiety loop. The other thing that we can remember to do is practicing self-compassion but not self-pity. So let's remember, anxiety can be normal also. If there is truly a sign of danger approaching to the internal homeostasis, then of course all of us need to be anxious to push us towards action. So it becomes a problem only when it continues to occur in the absence of a danger. So let's practice self-compassion in the sense that let's accept ourselves for having uncomfortable thoughts and feelings once in a while and not judge ourselves for feeling these or having these experiences. Same time, let's also remember not to engage in self-pity. That can also become detrimental. Moving on to depressive disorder, which is a slightly more debilitating disorder. Now, unlike anxiety and stress, which have clear mechanisms of action physiologically, less is known about depression when it comes to the mechanisms underneath. But more is known as to how depression is manifested in general public. And depression, as we know, is a very debilitating disease, one of the most common cause for suicide. And in fact, maybe in India we don't have actual numbers. As per the WHO again, in the US burden is 50,000 lives lost to suicide due to depression every year. So which is a huge number, and in India we of course don't have such accurate data. Now, depression, like I said, the manifestations are what we know more of. Physically, manifestations of depression would be basically slowing down of all the processes. It can be slowing down of speech, how you walk, how you mentally process things. So basically, it will be observed that a person is not able to function in a way that he used to function before, and there is a rampant slowing down in his way of life. At a more mental and an emotional level, it is manifested in terms of persistent sadness, hopelessness, loss of self-esteem. And the key word here would be persistent. So sadness in response to a particular event and then coming back to your average mood will not amount to a clinically depressed person. So sadness is persistent for, let's say, about 2 weeks, then it amounts to a clinically significant depression. Now, depression, the other striking factor is ruminative guilt. And this guilt which is ruminative becomes important because it can impede the person who is undergoing or going through this depressive phase in seeking help. The guilt itself will overwhelm him from reaching out for help, and of course he's also going to be thinking very slow. So this is the reason why we need to be very aware of the manifestations of depression, because depression is also very common, like I earlier mentioned. Now, depression. How do we address depression? Unfortunately, the best way to address depression would be to seek professional help, and all the home cures that we have may help in milder forms of depression or can temporarily give a relief, like probably exercise. Again, one of the evidence proven methods as an augmentation to medication, that is exercise, because exercise, again, within just 5 minutes of exercise, there's enough oxygen burst in the brain and enough endorphins and neurotransmitter release which helps in mood upliftment. So this is the short-term relief, mind you. And the other thing is long-term. It's proven that if it's around 30 to 35 minutes of low-intensity exercise for around 10 to 12 weeks, that itself can produce a sustained elevation in mood if it is done for 10 to 12 weeks. Connecting with significant others. So socialization can help in alleviating some symptoms of depression, but it may not be the end cure. So depression, like I said, although professional help is required and although the mechanisms are not really known, for depression, the treatment is therefore tailored and personalized from individual to individual depending on the manifestations. When it is stress and anxiety, it depends on the mechanisms, the drugs that are given for it. Now, for depression, it can be either a combination of drugs or without drugs also. Yes, depression at certain lower level can be treated with psychotherapy or a combination of both, but the treatment is designed based on the manifestations and not the underlying mechanisms, and there's a lot of debate about the underlying mechanisms. However, having spoken all this, one message that I would like to leave across would be, whether it is stress, anxiety or depression, these are all universal human experiences that everybody experiences at some level at one point or the other. And the hope here is that There is professional help available for at any level of distress on any of these spectrum. And given the pandemic's impact on our daily lives, let's all assume that we are all under stress, and let's start taking our mental health seriously. Thank you.